Atrial flutter. Introduction. Heart contractions are synchronized. Select true or false. Correct. The atria contract together, and then the ventricles contract together. AFL causes the heart to beat too fast. Select true or false. Correct. Kurt has been having a difficult time performing his daily activities lately. He noticed that he has episodes of a fast but steady heartbeat. He gets dizzy and short of breath at times. Should he see his healthcare provider? Select yes or no. Correct. Symptoms like dizziness and shortness of breath may be a sign of a problem. Kurt should contact his healthcare provider. Is atrial flutter always found in people with other health conditions such as heart disease or diabetes? Select yes or no. Correct. In some cases, the exact cause of atrial flutter is not known. Is surgery always needed to treat atrial flutter? Select yes or no. Correct. Treatment for atrial flutter may include surgery, but usually medicines or other procedures can control atrial flutter and surgery is not needed. Living a healthy lifestyle can reduce the possibility of developing AFL. Select true or false. Correct. Atrial flutter caused by coronary heart disease may be prevented by living a healthy lifestyle. Living a healthy lifestyle was proven to reduce the possibility of developing coronary heart diseases. Thank you for using Explain.